Greetings, this is Dr. Amy Kosler. This module is about psychological disorders. The chapter includes information about general concepts of abnormal behavior, anxiety disorders, dissociative disorders, mood disorders, schizophrenic disorders, autistic disorder, and eating disorders. Segment 3 includes information about schizophrenia, autism, and eating disorders. Schizophrenic disorders involve severe disturbances in thought that spill over to affect perceptual, social, and emotional processes. Schizophrenic syndromes all share some general symptoms. A central feature is irrational, disjointed thought processes, including delusions. Delusions are false beliefs that are clearly out of touch with reality. Schizophrenia also tends to bring deterioration in the quality of a person's work, social relations, and personal care. A variety of perceptual distortions may occur, with auditory hallucinations being the most common. Schizophrenics frequently hear voices of non-existent or absent people talking to them. The Nobel Prize-winning mathematician John Nash has struggled with paranoid schizophrenia since 1959. His story was told in the film A Beautiful Mind. There are 4 types of schizophrenic disorder. They include paranoid schizophrenia, catatonic schizophrenia, disorganized schizophrenia, and undifferentiated schizophrenia. Paranoid schizophrenia is dominated by delusions of persecution, along with delusions of grandeur. Catatonic schizophrenia is marked by striking motor disturbances ranging from immobility to frenzied motor activity. An individual with catatonic schizophrenia might experience a catatonic stupor. When this takes place, the individual will stand or sit in one place without moving a limb for hours at a time. Disorganized schizophrenia involves a particularly severe deterioration of adaptive behavior, frequent incoherence, and virtually complete social withdrawal. Undifferentiated schizophrenia is the diagnosis given to people who are clearly schizophrenic but who cannot be placed in any of the 3 other categories. Schizophrenic disorders are far less common than anxiety or mood disorders, occurring in roughly 1% of the population. In the United States alone, there may be several million people troubled by schizophrenic disturbances. The onset of schizophrenia is usually seen in the teen years or early adulthood. It may come on suddenly or gradually. Some patients with milder symptoms recover completely. Others may only experience a partial recovery, and some continue with chronic symptoms and may need permanent hospitalization. Like mood disorders, schizophrenic disorders appear to be accompanied by changes in neurotransmitter activity. Excess dopamine activity has been implicated as a possible cause of schizophrenia. However, the evidence is complex and open to debate. Neurological variations may also contribute to some cases of schizophrenia. Research suggests that there is an association between schizophrenia and enlargement of the ventricles in the brain. Ventricles are the hollow, fluid-filled cavities. The neurodevelopmental hypothesis of schizophrenia asserts that schizophrenia is caused in part by disruptions in the normal maturational process of the brain before or at birth. Evidence suggests that schizophrenia is more likely to develop when people grow up in homes characterized by communication deviance. This might consist of vague, muddled, fragmented communication from parents and others. Theorists believe that communication deviance undermines young people's sense of reality and encourages them to withdraw into their own private world. Thus, this sets the stage for schizophrenic thinking later in life. Expressed emotion is the degree to which a relative of a schizophrenic patient displays highly critical or emotionally over-involved attitudes toward the patient. A family's expressed emotion is a good predictor of the course of a schizophrenic patient's illness. As these data show, schizophrenic patients from families high in expressed emotion show a relapse rate about 3 times that of patients from families low in expressed emotion. Most theories of schizophrenia are stress vulnerability models. These models assume that stress interacts with vulnerability in triggering schizophrenic disorders. Various biological and psychological factors influence individuals' vulnerability to schizophrenia. High stress may then serve to precipitate a schizophrenic disorder in someone who has become highly vulnerable. Autistic disorders. Autism is characterized by profound impairment of social interaction and communication and severely restricted interest in activities. These symptoms are apparent by the age of 3. Since the 1990s, we have seen an increase in the rate of about 4 times that of before the mid-90s in autism. Autism is currently found in about 1% of the population. Eating disorders. Anorexia nervosa involves intense fear of gaining weight. This disorder also involves disturbed body image, refusal to maintain normal weight, and use of dangerous measures to lose weight. Bulimia nervosa involves habitually engaging in out-of-control eating. This out-of-control eating is then followed by unhealthy compensatory efforts, such as self-induced vomiting, fasting, abuse of laxatives and diuretics, and excessive exercise. Binge eating disorder involves distress-induced eating binges that are not accompanied by the purging, fasting, and excessive exercise seen in bulimia. This concludes our conversation of psychological disorders. Segment 3 has focused on schizophrenia, autism, and eating disorders. Please let me know if you have any questions.